Good evening, everyone. Welcome to this week's episode of MeZooMin. I am your host, Rabbi Chai Posner. We are joined back this week, back from vacation. You could see his tan, Rabbi Dr. Eli Yogev, and of course, our Mora D'Asra senior rabbi, Rabbi Mitchell Wahlberg. Welcome, everyone. It is nice to see you. And this week, we're especially joined by Dr. Michael Kleinberg. We'll tell you more about him very shortly. It doesn't look like I'm away, but in theory, I'm away. This week, I'm off. It's my staycation week. This week and next, spending some time with the family. And actually, we were supposed to be in Israel this week and next week. We planned this a long time ago. We had a bar mitzvah to celebrate cousin's bar mitzvah. But alas, we're not in Israel. But Eli Ram said to me, I'm really disappointed we didn't get to go to Israel. But it's been a great summer. We've had a lot of family time and a lot of laying low. And we enjoy that. And I was grateful that he recognized that and that he appreciated that. Rabbi Dr. Eli Yogev, welcome back. How you doing?
Hi, everyone. Welcome back. If I look a little tired, it's because Chai's been off the whole week and it's a few things to do over here, but at least I look tan from last week. So it's funny. I was supposed to go to Israel this summer also for a 2-week vacation, but I realized that would be the worst vacation ever because you have to seclude yourself for 2 weeks. get on and get off. Everything's well, thank God. We're in Parshat Re'eh. Happy to share a thought about that after Rabbi Wahlberg comes and says hi. Is he here?
Yeah, no, let me just say hello. Posner and Yogev, they're always on vacation. I work 24 hours a day, 365 days out of the year. And these two, these young ones, I could learn a lot from them. But it's good to see them, and it's good to see all of you. And I'm especially pleased by our special guest that we have tonight, Dr. Michael Kleinberg. You're going to hear more about him, but he's not aware of the fact that every night before I go to sleep, I think of him, because he and 2 or 3 other doctors are the authors of a paper that is named Galactomannan Antigen Detection Using Bronchial Wash and bronchoalveolar lavage in patients with hematologic malignancies.
The connection's not so good, Rabbi Wahlberg. We couldn't.
When I can't fall asleep, I pick up this paper, and 3-4 seconds, boom, gone.
Rabbi,
Eli, let's hear a Devar Torah.
Rabbi, that's ironic because Dr. Kleinberg, when he can't fall asleep, he picks up last year's Yizkor sermon.
And it does the same thing. Fair enough. That's great. Good.
Rabbi Yogev, what do you got?
Yeah. It's just a thought on Parshat Re'eh, something nice I heard this week. Oftentimes, Re'eh talks about the blessings and curses, and all of us want blessing in our life. So, especially in these times. So usually when it presents these things, it talks about them with the language of im lo, or im. If you do this, you'll get that. If you don't do that, that will happen. And so when it talks about the curses, it talks about in that language, im lo. If you don't do this, this is what's going to happen. When it talks about the blessing in the very beginning, it doesn't use im. It uses when. When you do, this is the blessing when you do this, and that will be the blessing that you'll get. And the language is much more immediate. And I heard a rabbi say that this hints to the idea, and that rabbi's me, by the way. It hints to the idea that the blessing of God is more immediate than the curse, than the negative influence. And it comes to hint to us as kind of we're getting ready. We've been writing content for the high holidays. We've been doing a lot. The rabbis have been very involved in getting things ready for the high holidays. As you get ready for it, it's good to remember that the blessing is near. It's closer than we think, and it's just about seeing it, re'eh, and it's just about when. It's very accessible, and God's accessible, and it kind of pushes us towards that direction. So I think that was a powerful idea, that it's easier to receive the blessing than the curse.
I love that Devar Torah, and I love a similar thought, but it's a little bit different, similar in terms of the wording there and the distinction. It says eta bracha, the bracha asher tishmu, that you will. You translate it as when you will, that you will get when you listen to the mitzvot. And I love the Dvar Torah that shares that the bracha itself, the blessing itself, is following the life as it's outlined for us by the Torah. Is that there's so much blessing in and of itself for self-discipline, for living a happy life, for family, and for so much that Jewish life gives us. And I think that we especially see that these days with everything that this virus has brought on for people. I think there are a lot of people who have turned, this past week, Monday, was the conclusion of learning Gemara Shabbat, Tractate Shabbat, which is 157 pages. And so according to those learning the Daf Yomi, it was 157 days ago, this past Monday, that they started learning this Gemara. It started a couple of days before Purim. And people have felt, the thousands of Jews, I wonder if it's even hundreds of thousands, I don't know, worldwide, who are learning Daf Yomi, felt that this learning has really given them something to focus on, something to think about, something dependable that you could come back to every single day in an island of chaos that we're living through. So there's a lot of good, thank God, that can be found in Judaism, of course. And it's the motto. This was one of the first things I noticed when I came to Beth Tefillah. But celebrating the joy of Judaism, we know that's Rabbi Wahlberg's, it's his mantra, and he always wanted Beth Tefillah to be that kind of place. And I think that, thank God, we've been able to continue to do that amidst everything that's going on. And in no small part, this program that we've been doing with MeZooMin and seeing people on every week has been great. So in a moment, Rabbi Wahlberg is going to bring Dr. Kleinberg on. Before we do that, Rabbi Yogev, do you want to share our trivia question of the week?
Yes, here is our trivia question of the week, connected again to our Parsha. Parsha also talks about Am Yisrael's holiness and what we should stay away from in order to retain our holiness. So there are three kinds of forbidden food: meat and milk, pork, and insects. And the question is, according to the Torah, which consumption is considered the most severe? Milk and meat, pork, or insects? Not which sounds the best, the exact opposite. Which one is the most severe in terms of being forbidden in the Torah? Please feel free to put your answers in the chat bar, and on Facebook Live, we'll take a look at them too.
All right. With the thought of pork and insects as an introduction, we are happy to have with us today Dr. Michael Kleinberg. One of the wonderful things about being a rabbi of a synagogue like Beth Tefillah is the people who make up the Beth Tefillah family come from such diverse backgrounds and interests. I knew Dr. Kleinberg was a doctor. Dr. Kleinberg, his wife Allison, are regulars at Shul. Nice, balabatish, quiet, never doing anything to draw attention to themselves. And then all of a sudden, I find out that this Dr. Kleinberg is director of infectious disease program at the University of Maryland Greenebaum Cancer Center, director antimicrobial stewardship to improve clinical outcomes program, University of Maryland Medical Center. It was as if that the coronavirus was created just for us to really get to appreciate how fortunate we are to have Dr. Kleinberg in our midst. So without further ado, Dr. Kleinberg, say hello and tell us who you are.
Hey, how are you? By the way, there's a second Dr. Kleinberg on, all the way from Florida, a graduate of Beth Tefillah.
Oh, that's
and
nice.
His brother, the lawyer here in Baltimore, and my wonderful daughter-in-laws. And I see that I've padded the participants with a whole bunch of friends who have come on, and I appreciate that and the rest of the Beth Tefillah family. Thank you for having me.
Dr. Kleinberg, where were you born?
I was born in Newcastle, England.
Why, and what brought you to America?
Well, my father was doing his graduate degree at Durham, which is a very prestigious university there. I left when I was 2. I am Canadian in addition to being American. I lived in Winnipeg, Canada for another 15 years. That's a very cold place. I don't want to hear any complaints about snow and cold. And when I was 17, moved to New York. and moved to Maryland in 1986 to go to the NIH, and came to Baltimore shortly in 1989, and I've been here ever since.
How'd you meet Allison?
Allison was in physical therapy school where I was in medical school at Albert Einstein in the Bronx.
Wow, nice.
As my father-in-law of blessed memory used to said to Allison, if you can't find a Jewish doctor at Einstein, you're not looking hard enough.
That's good. Well, she picked a real winner. Okay, so what got you interested in infectious diseases?
People who go into infectious diseases are people who are just fascinated by puzzles. This is universal in infectious diseases. A person who practices infectious diseases is not limited to one small part of the body. So we treat the entire body. Coronavirus is a perfect example how it's always changing. There's always something new. It never gets boring. But the most fun part of infectious diseases is having a patient with a complicated infection. Nobody knows what's going on. And then finding the answer, and then applying the treatment. And that sometimes, many times that's an antibiotic, but sometimes it's not. And having the person get better. Because one of the great things about infectious diseases is, in general, people get better pretty fast. It's very gratifying.
Oh, so you have a lot of success stories.
Yes, quite a few.
Are you dealing with many patients who have the virus?
I deal with a few. Fortunately, we have been able, within the Cancer Center at University of Maryland, we have been able to keep the number of patients with coronavirus lower than maybe would happen with patients who have pulmonary problems, for instance. But I will say I spend the bulk of my time on coronavirus and how to protect patients and staff from getting coronavirus, and how to, if somebody should happen to get infected, how to minimize its spread through the University of Maryland and through other patients.
Basic, how do we prevent ourselves from getting the virus? Wash our hands.
Washing hands is probably, of the four things you're going to do, washing hands is probably the least important. You should do it because you should do it.
I've been washing my hands for no reason.
Just,
God.
You all heard it right here. Dr. Kleinberg says, no meat.
Let's go through this a little bit. When it comes to coronavirus, the reason you wash your hands is so that if you accidentally get some coronavirus on your hands and then you do this, not even thinking about it. There are videos and studies showing how many times people touch their face. It's unbelievable. And so that's the real concern with transmitting the virus from a surface to touching it to your face.
The mouth, the orifices, the mouth.
That's what really, that's one of the important purposes of a mask. So the mask obviously is so you don't inhale something, but it also means that if you go to touch your face, you're going to touch the outside of your mask and not put it into your mouth. So the most important things when it comes to coronavirus are masking of both the person who's infected and the person who doesn't want to get infected. Standing, separating yourself, standing, sitting apart from someone else. I have to say that doing it through the computer is a pretty good way to stay apart from other people, all right? And also very important is to shrink your social network. So if you were a gregarious extrovert, gee, I think I'm describing the rabbis at our synagogue, you have had to contract who you mingle with on a daily basis. And it has to be a trusted network. And you have to know and trust that the people that you interact with on a daily network are also being careful. So if you do all of those things, you can prevent getting infected. And if this whole country would do that, we could actually reduce the coronavirus down to very, very low levels, which really simplify so much of what we need to do to get back to normal. So when it comes to masks, the important things, the reason everybody has to mask is because a mask will protect you And if you happen to have coronavirus, you won't spread it. And it's that combination. For the person who has the virus, think of it, you're walking around with a handkerchief over your mouth the whole time. So that means you're just listening to what your grandma told you to do when you cough or when you sneeze, right?
All of these politicians or doctors who make light of the mask, they're playing games with our lives.
Well, I'm not going to say about playing games, but I mean, there is, I mean, you know, in the same way let's put it this way. I trained under Tony Fauci. Bob Redfield, as the head of the CDC, used to be my boss, okay? I know these two men of the ultimate integrity, okay? Wow. And to see them be in this pressure cooker of the political bending is really, it actually makes me cringe. And so I want to say that the way to look at this is what does the science say? What do we know? And then how you interpret what we know, well, that's up to you. You can be crazy like politicians, or you can be like we are, which is we look at it, we look at what we know works. We then apply it to how we live so that we can live as safe as we can and still have as much fulfillment out of our lives as we can. And that includes being able to practice our religion and be able to share our community with Beth Tefillah. And it's finding that balance between safety and how much we can get back to ourselves and to our community from practicing safely.
Okay, so let's get to that. Let's talk in terms of the synagogue, not in terms of the school. Dr. Shore, who had another meeting tonight and can't be on, had told me that if anybody has a question about the school, we should mute them. That her policy is she'll close if it snows. But other than that, they're trying to open the school. We've made arrangements for the high holidays. Now, one of the arrangements we've made for the high holidays is to have a service in the main sanctuary, to keep it short, an hour and 15 minutes, to have everyone wearing masks, and to practice real social distancing. In a sanctuary that seats 1,600 people, we will only take in 250 because that's how socially distant we're going to make every seat that's filled. Is it safe to come to Shul Rosh Hashanah?
Yes,
wait,
I think.
And does age make a difference?
Okay, so let's go through this because there's a lot there. Is it safe? Yes. Why? Because the way the arrangements have been done, that you have the distancing between people. Why is the distancing important? Because when we speak, when we cough, when we sneeze, I don't know about blowing the shofar yet, but when we do all those things, we release droplets, which are, as disgusting as it sounds, small particles of spit. I mean, we've seen pictures of when someone sneezes and how the cloud goes out. So they weigh something and gravity pulls them down. And the droplets that we cough out have different sizes. The big juicy ones, well, they'll fall within a few feet. But you also cough out some very small ones and they'll travel a little bit farther. So since you have to set some kind of boundary, that's why we come up with 6 feet, because the vast majority will have already fallen and hit the ground at 6 feet. And the way the seating arrangements are at Beth Tefillah, you have proper social distancing. And it isn't just this physical separation, but everybody's going to be facing the same way, which means that if someone behind you coughs, now we all know that all of us have eyes in the back of our heads, but we don't have noses and mouths in our back of our heads. The next thing is the implementation is everyone has to wear a mask. Okay, so that again, you get protection so that when you breathe in, some of the droplets will not go through the mask. Plus, if someone is infected, and of course they won't know they're infected, because another important thing is no one is going to come to Beth Tefillah if they have any symptoms of a cold, the flu, anything like that, okay? So that will also be protected because they'll be sneezing or coughing, into their mask. And we do expect, and I think it's important, as you have stressed, Rabbi, that we kind of have an understanding within our community that none of us who come to Shul will be reckless in how we interact with other people so that we minimize our chances of coming into contact with someone who's infected. Remembering that almost half of people who have the virus have no symptoms whatsoever, yet the amount of virus that they breathe out is the same as someone who is infected. This will be a real problem, and who you are not going to invite to Rosh Hashanah dinner,
I have a whole list.
Yes. So by that, it's safe. You then raised the second issue about being afraid. And this gets back into, I can tell you what we know. I can tell you what works. But how an individual interprets it, their level of fear, for instance, that's a very personal issue. And I, for one, will not criticize someone who is overly fearful, who may go to an extreme to limit the exposure to the virus, but I will criticize someone who is cavalier in regard to the virus. So the fear and being afraid is an individual choice. I can only try to assure you that what Beth Tefillah has done is as safe as is possible, and certainly meets all recommended guidelines, for instance, from the CDC.
Dr. Kleinberg, what you just referenced, and it was something you had said to me early on, we talked about it, sort of that like social contract and being a part of this with others and the courtesy that we give to others and the way that we're careful, to me was very beautiful in terms of an overlapping of what makes sense safety-wise and scientifically and medically, and also what would be understood as a Jewish value, having people in your community and, sensitivity towards everyone in terms of what's needed for everyone. And even if someone were to think, oh, I personally don't think I need to wear a mask. Okay, but there's other people here who feel that you should. So do that, right? Or in terms of how careful we're being. I think that's a very, very beautiful way. The truth is I saw that obviously scientifically, medically, we're talking about now, but spiritually, you could expand that out, in a very beautiful way, understanding that everyone has different needs. And whether, even if we're not talking about science and medicine, we could be talking about people's ability to see what's going on or hear what's going on in a normal setting, right? Or make their way out the door slowly or quickly. Like there are all kinds of different things when you get different people together, and recognizing that it's not just about me, but it's about the people who are around me is both like a very thoughtful, safe, healthy, medically healthy way to do it, but also very much like the way a mensch lives their life.
Let me just mention, Dr. Kleinberg, you had mentioned the blowing of the shofar, and we have discussed this. But one of the things we have in mind is, so to speak, to aim the shofar down, not to have it facing out to the audience, blowing out these droplets, so to speak. And another that we had discussed is putting a woman's hosiery on the top end, so that would capture whatever droplets might be coming out. Does this still seem reasonable?
No, I think it is reasonable. I would, there's some minor things I would say, which we can talk about afterwards. But, I heard when I was discussing this at work with someone, it kind of came up in a strange way. But one of the things that was suggested, well, why don't you just have someone who's already had coronavirus and recovered from it, therefore is immune and can't transmit, and have them blow the shofar? Actually, you could have them become the rabbi and the cantor and everything else as well.
Dr. Kleinberg, there was a situation a while back in Israel where I forget all the details, but basically they were looking for a Moel who had coronavirus. They were searching all over the place because I think it was a situation where like the family had, and they wanted to bring a Moel in or something like that, but it's just interesting.
It's 5 weeks before Rosh Hashanah. In 5 weeks, I could train somebody to be a rabbi. I don't think I could train them to blow the shofar. That's a skilled profession.
Yeah,
Let me ask you one more question, and then we do have some questions that people had sent in. when are we going to be finished with this?
Okay, so let me give you some numbers. Right now, I think the estimate for Maryland is that 3% of the population has been infected. So with 3% of the population is immune, that will do nothing to shorten the epidemic. So we need a vaccine. Let's say the vaccine starts to roll out at the beginning of January, which is pretty optimistic. And it's not so much getting the vaccine tested, it's just the logistics of making hundreds of millions of doses is not trivial. Then let's say we start vaccinating people. You know, there are going to be some people who are not going to get vaccinated. That will be unfortunate. If it ends up being like the flu vaccine, 50% of us will get vaccinated. Now, 50% people getting vaccinated makes a huge impact on how much spread can happen. Its impact is way more than a 50% reduction. It's probably more like a 80% reduction, but that's still not going to be enough to prevent the spread of the virus. So we're still going to be dealing with this in some aspect, but we'll be dealing with it in a different way. And by the time everybody gets vaccinated, it'll probably be late spring, June of next year for the people who agree to get vaccinated. So this is going to be a mess. And I think a mess is the way to describe it. It's going to gradually get better, not suddenly get better. And we're going to, issues that I can't even imagine, we're going to have to deal with about what do we do with people who haven't been vaccinated and how will they fit in. And the people who have been vaccinated are certainly not going to put up with continuing to mask. And then you're not going to know it's just going to be a big mess. So what I'm saying is we're going to have to put up with this for another, probably into the middle of the spring. Everybody please get vaccinated. It will really, really help us. The vaccine is probably going to end up being a pretty good vaccine. How good it's going to be for elderly people, and I guess, Rabbi, I use your definition, Rabbi Wilberg, I use your definition as somebody who's older than I am.
That's it.
But for elderly and the very young, but eventually that's going to make a difference. But we could easily be dealing with this for months and months and months.
We're going to be Zooming into next year.
I think what'll happen is gradually people will get more comfortable with the way we've done things, and we'll make some modifications, for instance, to seating arrangements and things like that. I suspect we'll start getting a little bit braver. A lot of that depends on the fact that Maryland's done a very decent job of really being able to keep the amount of infection in the community down fairly low. So, you know, we talk about positivity rates, we talk about prevalences, and those numbers are pretty low. But I think if you were to look at, they're not the same throughout all the different populations within Maryland. And I think the 21208, 21209, you know, the Owings Mills type zip codes are probably even lower than the state average. And that is a huge factor in terms of safety.
All right, we thank you. I mean, I could go on talking to you forever, but we did have some questions. Rabbi Yogev, do you have them?
Yeah, I have a few questions. Two people asked.
Rabbi Yogev, how did the shul function this last week while you were away? It's unbelievable. I'm telling you, good.
I'm picking up all the pieces now this week.
Go ahead.
Again, thanks for sharing. Your perspective is so broad, and you've thought all the stages through. It's extremely helpful to see the bigger picture. So thank you so much for that.
This is a lot of my professional life right now.
Yes. Yeah, but you put it all together in a great way. It's helpful. So kind of going on to the micro, two people asked the same question with regards to packages and surfaces. It's like when you bring in packages from the supermarket, is it advisable to wipe them all down, or is that, somebody asked that?
The CDC has now recommended not doing that. I think personally, this gets back to level of comfort. I certainly do not recommend doing that. I think if one is doing, if one takes the packages from the supermarket, puts everything away, then washes your hands, and you're doing all of that, I think wiping down the packages adds nothing. That's my personal view. And that is what I recommend. I can understand, though, because I know people who do that. And I still think the world of them. And if that's what you're comfortable with, then you do it.
Is the idea, Dr. Kleinberg, just to double down on that for a minute, because I've seen some other questions, is the idea basically what you're saying is that this virus would not be living on surfaces?
It doesn't live on surfaces for very long. And so the way you would get infected from a surface would likely be, you know, somebody who's infected has it on their hands, they turn a doorknob, they go into, let's say, to a restroom, you come in a minute or two after them, put your hand on the doorknob, open the door to the restroom. That would be a more common way of transmission from a surface. But if for packages from a supermarket, it'd be much less likely, and certainly food. But again, I'm assuming here that people wash their hands, which you should be doing, period, even without coronavirus.
Well,
Certainly when you touch food.
I stopped doing it after you told me at the beginning I didn't have to.
I hope you enjoyed your break, your holiday.
I saw you sneaking some Purell under there, Rabbi Walker.
Okay.
So I guess just to follow up on that, so it lasts on surfaces not 2 minutes for sure, but not 2 days, not 1 day, several hours?
No. In extreme circumstances, in the laboratory, they're able to find conditions where they can get it to survive prolonged, but in the real world, the CDC has backed off a tremendous amount on decontamination of those kinds of surfaces. What they're really looking for are what we call common touch surfaces. So for instance, in Beth Tefillah, it would be the bathroom by far. In schools, it would be more surfaces than that, but it's the common touch surfaces that are the ones that should really be the target for disinfection.
You should be aware we're going to obviously having our combined campaign after the holidays, and we're going to be appealing to people for funds. Major givers will be able to use my private bathroom. I just thought that I would put that out there now in case you wanted to plan accordingly.
And that's safer than the other bathroom, Rabbi?
With Sherry around, everything is kept very, very clean. Let me just say that. Any more questions?
Yeah, before this gets unclean. So 2 other questions were asked in regards to chlorine and also food services. So going to restaurants, is it true that, what's Rabbi Posner have there? Some with you.
Just making a l'chaim with someone on screen.
All right. I say Gary and
That's
they can't drive.
So those are 2 questions. Like chlorine, is there a fear of it spreading in a pool? And in addition, food. So going to restaurants, is that fine if they're wearing masks and the food's being heated up? Should we be concerned about that?
Yeah, I don't know for sure about pools. I think the water in the pools is fine. I think the concern there would be common touch surfaces. When it comes to restaurants, you said there is an element of trust when you go out to a restaurant. You know, it's not going to be, look, when we come to Shul on Rosh Hashanah and on Yom Kippur, we trust that as the plan is being implemented effectively. We trust that the bathrooms are being cleaned. We trust that. And that's really important. When you go to a restaurant, you are trusting, because the owners are supposed to, not let infected employees work. And this has been a problem in restaurants and has led to restaurants being shut down. So you are trusting that whoever's preparing your food particularly is not infected, that they're wearing a mask back there. I have one of our friends related how she went into a restaurant and scolded a manager because she saw that the cooking staff were wearing their masks under their chins were very well protected with the masks that they had.
Someone should put out like a small skit on like the different types of wearing masks. The nose out with just the mouth.
It's out there.
That is out there.
Yeah, I'm sure it's out there.
On the ear. People like.
Dr. Kleinberg, do you have any thoughts or recommendations on what types of masks? I ask that a lot also.
Okay, so let's go through the masks. Remember, masks serve two purposes. Okay, so the person who wears the mask who's infected, so the mask captures the droplets, and the mask that someone who's not infected wears to protect themselves. So let's talk about the latter first. There is something called an N95 mask, okay? 95 stands for 95%, which means that for incredibly small particles, even smaller than the ones we're talking about with coronavirus, 95% of them will be filtered out by the mask and not reach the mouth of the wearer. Those are the kinds that we wear in the hospitals when we are in very close proximity to a person who's infected and who's just spewing out virus, because these masks will protect us. The problem with these masks is that they are very hard to wear because everything filters through the mask. You're working to breathe. Just pretend, for those of you who've been on a mountain trail at 8,000 or 10,000 feet, how hard it is to get air. That's exactly what it feels like when I wear one of these masks. It's hard to talk. Those are not practical for wearing every day. The next level mask are the surgical masks. So the surgical masks also will protect you, but instead of being 95%, they're probably down in the 85%. They are easier to breathe when you wear one of those. But for walking around with them every day, they're made out of paper. You're not going to be able to wear one of those every day and have it maintain its integrity. It will degrade. And that's why if you look at, for instance, CDC guidance in schools and CDC guidance elsewhere, they talk about cloth masks. The cloth masks are probably in the N60 to 70 range. So that's why if you're wearing a cloth mask, everybody has to wear a cloth mask. So because if the person who's coughing wears the cloth mask and you wear a cloth mask, that combination gives you really good protection. Now, when it comes to cloth masks, there's a bazillion out there with all kinds of very interesting artwork that are on them. But for protection, hold your cloth mask up. If you can see easily through it, it's not going to protect you. Okay? All right? So you may have heard that the masks that are popular that are basically almost like a kerchief that you pull up, that are this flimsy, gauzy material. There was just there's something on the news saying they're actually worse than wearing no mask when it comes to someone who has the virus and they cough it out, because because when you cough through one of those big droplets splinter into smaller droplets which travel farther.
Wow.
So that would be when you're looking at a mask. If the mask, you shouldn't be able to easily see through it, and it's got to fit around your nose and your mouth. By the way, a mask that covers only your mouth and not your nose is tremendously degraded in its ability to protect you, needless to say. And certainly one that protects your chin is totally worthless overall. So that's why I think for every day in Maryland, where we have pretty good compliance with masking, I think the recommendation for cloth masks for everyday use is probably the proper one, because it's less fatiguing, plus you can wash them than using some of the medical masks.
Dr. Kleinberg, let me just say, I haven't really had to wear a mask because I have so rarely, hardly ever, left the house. But I do know, being in Shul on Rosh Hashanah, to wear a mask for over an hour, for some people is not comfortable. I got a mask you spoke about, the artistic work. This one says, this mask is making me schwitz.
Right.
So, everybody who is in the synagogue will know how the rabbi feels about all this. What the rabbi can't relate to is, you've made reference to people who have been on a mountain trail at 8,000 to 10,000 feet. I don't know any Jews who have been on a mountain trail. I know they've been to Bermuda and are mountain trail 8 to 10,000 feet. I'm not too sure that this is a right for the Beth Filler crowd. Let me just wrap things up a little bit before Rabbi Posner is going to tell us what we have coming up the next 4 weeks. I scan around the Zoom room, and it's nice to see all of you. Some faces stick out. Like I see Charlene Schimberg. Charlene hadn't been well. She had surgery. It's certainly glad to see you back with us. I noticed that Fran and Steve Bruce are watching this separately, and I'm just wondering why. Is there anything we should know? But we don't want to get too personal.
No. Asking that question on this in front of everyone else definitely wasn't getting too personal.
Oh, no. You know, confidentiality, I'm very big on, absolutely. And I see Saul and Barbara Mussey, and I want to tell you something. You know, we're going through a difficult time, and you can either kvetch or do something nice. Every Friday, I get some nice piece of artwork or some nice blessing that comes to usher in the Shabbos during this time. And it's nice to know that people can share some good things with other people. And I think all of us should give a little bit more thought to doing that for each other to help us get through what really is a crisis. I mean, none of us have had to confront anything like this during the course of our lifetime. And we certainly hope that we're not going to have to again. So, Rabbi Posner, where do we go from here?
Well, Dr. Kleinberg was talking about eating in restaurants and what spreads on what. So, Rabbi Yogev needs to tell us which is the most dangerously spiritual to be eaten. And we're going to answer our trivia question.
Yes, so to answer our trivia question, surprisingly, this was not answered by anybody. The insect is actually, according to the Torah, the most severe. I'm not saying it's the most spiritually harmful, but the Torah mentions insects 4, 5, 6 times in terms of prohibitions. Milk and meat is repeated 3 times, but there's only one prohibition when you eat it, which is amazing. 1 versus 5 or 6. And I think the message is relevant for this discussion. Some of the rabbis say, why is the Torah so strict when it comes to insects? Because it's so common. And it's small. And that's kind of what we're talking about. You know, there's, we have to be extra careful with things we don't see, like COVID, and guard our health. And the Torah wants to stress that we should be extra careful and always sway from the negative and attach ourselves to positive things.
That's the reason, for those of you who know or have heard of this, you know, when they so carefully check the lettuce to find any bugs, because an insect, a whole insect, even if it's microscopic, I mean, if it's microscopic and you can't see, there's nothing you can do about it. But as small as an insect is, if it's whole, it's considered a problem, and it doesn't become batel. So whereas if a little bit of milk falls into a pot of chicken soup, if it's a little bit of milk, it's okay. It becomes null and void. But that doesn't happen with the bugs. So in a moment, let me just share what's going to be happening in the next few weeks, and then we will we'll stay on for the after party for those who would like to join. Dr. Kleinberg, if you have a few more minutes to join us, I see there's still some people coming in with questions. I'm sure they'd appreciate it if you're able to. But now that we know that you trained under Dr. Fauci, you're a celebrity, and maybe you don't have any time, and that's okay also.
I was texting Rabbi Posner.
I'll be happy to stay.
I was texting Rabbi Posner. I trained under Rabbi Wahlberg. Is that like the same thing? Or?
Absolutely. Absolutely. For some people, you have more credibility. For some people, less. It all depends on where people are coming from. But I do want to let everyone know that beginning next week is beginning our Elul High Holiday planning. And part of our High Holiday experience will be 4 special MeZoomins where we have 4 special thinkers, scholars, rabbis, modern Orthodox thinkers, scholars, rabbis who will be joining us to add some spirituality and to add some knowledge to our Elul discussions leading up to Rosh Hashanah and to Yom Kippur. Next week, we'll be joined by Rabbi Benny Blech, who is an old-time friend of Rabbi Wahlberg's, and he himself is, you may have seen, you know what, you should, go ahead. You Google him, and you'll find he's got lots of articles available. He writes for Aish.com, and he writes great stuff on Aish.com, interesting and thoughtful and relevant.
The Idiot's Guide to Basic Judaism and some very deep books. He's an outstanding speaker and a terrific guide. You'll really enjoy it.
He's the type of person who really has his finger on the pulse of what's going on in the Jewish community. And so we look forward to him joining us next week. The week after, we'll have Dr. Erica Brown, followed the week after by Moshe Hauer, and the week after, Ilana Stein-Hain. They're all great thinkers and speakers, and they'll be sharing some inspiration, and we'll be chatting with them and asking some questions. We are grateful to Dr. Kleinberg. The time absolutely flew by, and I know people still have many, many more questions that they'd like to ask.
Can I throw in one special, because all of the people tuned in tonight? We just finished making arrangements today for our Penn lecture, which is going to be at the end of October. And our guest speaker is going to be Barry Weiss. Barry Weiss wrote for the op-ed page of the Wall Street Journal and the New York Times. And she recently was very much in the news because she left the New York Times because she felt she was being bullied and degraded because of her opinions about Israel and various other issues. That's another name you might want to Google, Barry Weiss, and that should be a special night that we have. We're planning all sorts of things. Until you come to us, we're going to keep coming to you.
Thanks for joining us, everyone. Have a good evening again. For those who would like to join an after party, I mean, if you've ever been to an after party with 3 rabbis and a doctor, it's going to be fun.
There's a joke there somewhere.
Take care.
All right, so we're going to stop our recording, and if people have questions, I saw Dr. Kleinberg. Thank you so much for joining us and being so open and flexible with your timing. It's much appreciated. A couple of questions that came up in the chat. Someone asked, when you're talking about the cloth mask, someone asked about a cloth mask with a filter, if that's better than a regular plain cloth mask.
I think so this is where a filter is placed in between 2 pieces of cloth. I'm assuming that's what it is. I don't think it necessarily offers any more advantage, but it can't hurt. I do want to say one thing. There's one kind of mask I want to discourage you from wearing. These are the contractor masks. You can buy them, and so what they have is they're listed as N95, but they have a valve right in the front. So when you exhale, it comes out the valve, right? So because they're designed for contractors, so they don't breathe in dust and stuff. They're not designed to protect other people from what you breathe out. So someone who wears that kind of mask is defeating the whole purpose of keeping your secretions to yourself. And so if any of you have those masks with the valves, please don't wear them. Don't wear them to Beth Tefillah, because you're not going to be protecting, the rest of the community. Okay, so I just wanted to make one comment on that. And actually, I think Dr. Redfield from the CDC actually made a comment on that just the other day as well.
Thank you. That's
a good memory tool is that contractors aren't that dependable, so you can just keep someone else asked, I think you kind of addressed this already, but they just asked it in terms of, should people keep mail outside?
No.
So for the,
I mean, that's my opinion.
Right.
Okay. I mean, eventually you have to bring it inside, don't you? I mean, are you talking about quarantining the mail? I guess I'm not trying to make fun of anybody, but I guess it's a matter of not reading it for a day or so to just in case it's infected. So I would think that's what that means.
I guess leaving it outside for a couple of days. I would recommend leaving the bills outside for even longer.
Yeah, I think so. Let's put it this way. Unless there's something really, really pressing, the world isn't going to change. Nothing's going to happen if you read your mail a day later than you normally would, unless, of course, you miss the sweepstakes winning. But other than that, I think you could do that if that makes you feel more comfortable.
Yeah. Somebody else speaking about outside. Somebody asked about masks outside. I guess like public gatherings outside, if you're properly spaced, do you have to wear a mask? Or?
As one, as we get into the Talmudic slicing into thinner and thinner slices, it becomes more and more difficult to answer. There is absolutely no doubt that outdoors is much, much safer than indoors. And all you have to see is that with all of the protests that happened over the last few months in all these different cities, and there have been no increases in coronavirus associated with those. Some of that is probably dumb luck. A lot of it is because most of the people were wearing masks, but a lot of it is because it was outside. If this had occurred in December and people were screaming their brains out indoors, we would have had massive spread of infection. So let's put it this way. Let's say you want to invite some people who are outside your social sphere and you want to socialize with them and you want to go onto your deck or onto your patio and you've got a 6-foot table and you want to seat your occasional friends on one end of the table and yourselves at the other end of the table, 6 feet apart. I have done that. So it has the Kleinberg seal of approval, okay? If you feel comfortable with that, I think you will be safer than if you did the same thing inside. So I'm not answering your question because, exactly, because I'm very good at dodging precise answers.
Trust.
But I think it's probably 5 to 10 times safer outside than inside. Okay,
But you would still, it sounds like you would still recommend masks if you're outside and gathering with people.
How windy is it? See, I mean, that's why it gets more complicated.
Right.
I have not done it with masks outside, on me personally.
With 6 feet. Just
6 feet.
Dr. Kleinberg, here's a different type of question. This is an intelligent question. Do you think the vaccine is going to be made with a live virus?
I think that's extremely unlikely. The way the virus is made is the way that the current viruses, the ones that are going to come to the fore are ones that are going to expose or present the spike protein. The spike protein, when you look at that picture of the coronavirus ball with all those little puffs on the outside, that's what the spike protein is. The spike protein will dock onto our own cells, and that's how it gets inside. That's how it gets inside our cells, and it creates all the mayhem. And so, if you can form antibodies, they'll latch on to the virus and deactivate the virus. So, all the vaccines are targeted toward what we call the spike protein. This is, in modern vaccinology, this is the way viruses are made nowadays. Making an inactivated virus would take 10 years. It takes a lot of time because of safety issues primarily. So we will not see I don't think we'll ever see a live virus vaccine. What we call an attenuated virus vaccine.
By the way, it wasn't my question. If people thought I was saying that I had the intelligent question, I was just reading it off.
Hopefully, I didn't go too far off into outer space explaining that.
No,
I wanted to give you a little background on what the vaccines, what's our immune systems are going to see in the vaccine. So in other words, you cannot catch infection from any of the vaccines that we're going to see, because it's not the whole virus. It's only a piece of the virus. You know? So it's kind of like when you get your tetanus shot. Okay, that's just a piece of protein. It's not the whole bacteria that causes tetanus. So that's what we're going to see with the vaccines. So you cannot catch coronavirus from any of these vaccines.
Are there, Dr. Kleinberg, I wanted to ask you, this is my question. Are there things that you see people doing now and you say, oh, finally? Like, were you sitting there on Shabbos looking around at everyone, like shaking, before all this, shaking hands, this and that, and thinking, I wish people would be a little more careful. And now, like, oh, at least people are aware that there's germs out there. But is that the thinking, or totally not? I'm curious.
I mean, you know that I have been the major proponent of the elbow bump going way back, and in particular during flu season. Okay, and now don't even do the flu. Don't even do the elbow bump.
We're taking
the bow.
Dr. Kleinberg says, make sure to elbow bump. Don't wash your hands. What else?
No, don't elbow bump. Just do a bow from a distance. Yes, I think I happen to agree with Dr. Fauci here. We just got to get away from handshaking as a social symbol of camaraderie in our society. You know, we have to be able to demonstrate that affinity we have for each other through some other means. Okay, needless to say, I think a lot of the kissing probably needs to go out too. I really don't recommend that in general. One of the problems with handshaking is if you shake the, and particularly in the old days in the shul, if I shook your hand, Rabbi Posner, I'm shaking the hand of every person who shook your hand at the same time. Okay.
Except the chazan wipes it off on the candy that he gives you, so
that's right.
Fine.
You didn't realize those were disinfectant candies.
All right, that's it for our questions. I think we got Rabbi Yogav. Were there any questions in the chat that we didn't answer? So someone asked about washing clothing and taking a shower immediately after coming back from being in a public place.
Well, those will work. Okay, so if we wear clothing, most of us wear certain elements of certain pieces of clothing only once a day. Take them off. Get into comfortable clothing in the house. That's perfectly fine. I think it depends on how exposed you are publicly. I know it's been. I know that a lot of the nurses I work with, the ones who really have close body contact with patients, they'll essentially walk in the house, strip off their scrubs, dump them in the wash, put on regular clothes, go to take a shower and put on regular clothes. So if you have that kind of contact, if this is in your job or wherever, then that is a good thing to do. If you have more casual contact, I'll leave that up to you.
Thank you. Thanks
so much for joining us and sharing all your knowledge with us.
I want to echo that, and I want to really thank you. You said you hope you didn't go too far off. I mean, it's interesting because these are the kinds of questions you do an Ask the Rabbi session. It's a similar kind of question. Like they start getting more and more detailed and more specific. But you really, one of the things that we've all appreciated throughout this all is your willingness, but also to explain it clearly and not go too far off and really just give us some clarity. So it's much appreciated. We'll end with one more question that just came in, which is, I'll just read it as it came in the chat. What about over 65 in shul? So someone over the age of 65 coming to shul.
The issues with older people is for reasons that I don't think are quite clear. Older people get sicker if they get infected. Now, I just want to say that the over 40-year-olds, the 40 to 65-year-olds, you are not out of the woods, okay? You may get less sick than someone who's older, but older people clearly have more problems if they get infected with more complications and certainly have a higher chance of dying. And some of this is related to the fact that we accumulate, as we get older, we begin to accumulate certain problems in various organs, be it lungs, heart, kidneys, etc., that we lose some of the reserve that the young whippersnappers have. But I think older people need to be really aware and careful. And I think if you come to shul and you practice the way we are going to set up the shul, I think you will be safe. I think it's a harder decision when you're older. Okay, and it's not unlike, I get questions, for instance, from older people, when can I see my grandchildren again? I had that happen today when I was in clinic. You're fearful because your grandchildren are in daycare or your grandchildren are maybe going back to school. They're going into an environment of greater exposure. Does that mean an older, a Bubi or a Zaidi has to isolate from their grandchildren? These are very tough choices. And going to shul is one of those choices. And the best we can do is to protect ourselves as much as possible. And I think this just reemphasizes the importance, the community contract, where we will protect all of us, but in particular the most vulnerable, by doing our part to wear our masks, to socially distance, to keep our social network smaller, because it's not just for us, it's for the broader community. And so I realize I'm getting a little trying to be eloquent here and failing miserably, but I would encourage someone who's a little nervous, who's a little older, to kind of try it. Maybe come to one of the shorter services and see how comfortable you feel, and go from there overall. By the way, I want to just end a little bit on a little story I told Dr. Wohlberg, because one of the things that I said was, you end up getting mask fatigue. So this was before, of course, we went to these lightning services, which will be a reasonable period of time. But I said it would be important to probably make an announcement that if you're getting a little itchy under the mask, you can stand up, walk, go outside, take your mask off a little bit, and do some hygiene, take your mask off, rub your face, put your mask back on, do some more hygiene, and come back in, and that the rabbis would give permission. You can leave even if it's in the middle of the sermon. So, I think.
Wait.
I wouldn't go that far.
I want you to know something. I have prepared, 3 sermons, Rosh Hashanah, Kol Nidre, Yom Kippur, but 2 versions of each. One that will send out or by tape, and one that I'll deliver in the synagogue. Each one in the synagogue is limited to 20 minutes.
There you go.
Which for me is just, my concern is that next year people are going to want the same thing. But let's wait for next year to see what happens.
Thanks so much. Great to see everyone.
Go to sleep, everybody.
And we'll see you all.
WYPR tomorrow morning at 9:30. That's the public radio station. Myself and Reverend King are talking about a joint program that Beth DeVilla and Liberty Grace are doing. That's tomorrow, WYPR. Okay?
Take care, everyone. Be well.
Bye-bye.
Have a great Shabbos.